Back pain in general is very common, and it is not unusual, and the statistics would say that it's probably closer to 90% of adults will have a period of significant back pain throughout their life, possibly lasting up to 6 weeks. When you should be concerned is when you have some neurologic symptoms such as numbness, tingling, severe radiating pain. Any type of bowel or bladder symptoms are always cause for severe concern, such as having trouble going to the bathroom, having numbness or tingling in the privates or genitals. Those are very important red flags, we call them, in which you should seek emergency department evaluation immediately. But otherwise, just your regular low back pain or mid back pain, very common, neck pain. As we get older, there's changes to the spine, to the bones and the intervertebral discs, or the shock absorbers of the spine that occur in all of us. And so it's not uncommon. And as we get older, we become more sedentary and don't exercise, sometimes gain weight, and smoking are all causes and reasons to have back pain. It's a huge problem, especially with central obesity or obesity around the belly, because you're putting a lever force and causing the spine to have to counteract that extra weight and pull yourself back. So more muscle spasms or low back pain, very common. As a surgeon, it's all part of my surgical decision making, because it makes my job a lot harder in surgery. There's higher risks. There's higher risk of infection and of wound problems or complications after surgery or following procedures. So it is a big issue. There's a whole host of mixed problems or syndromes. A lot of time people will come in with, let's say, arm pain, and they'll just say, yeah, I have arm pain, it's over here, and then it goes down my arm into my hand. And they'll think it's their shoulder, and in fact it's coming from the neck, where there's spinal nerves that exit the spinal cord and spinal canal and then go down the arm. So yeah, there's definitely a mix of problems, and patients can have both problems or even have 3 problems. They can have shoulder problem, they could have a neck arthritis and pinching of the nerves, and then they can also have a nerve pinching elsewhere, such as carpal tunnel or something going into the hand. So, and in terms of the low back, same situation. You could have low back arthritis or pain and pinching of the nerves that then goes down the leg, and they could think it's their hip, that they could think it's their knee, and the patient can be discouraged because they have to see multiple specialists before it's finally figured out. You do naturally get stiff in the morning. You haven't been moving, you've been laying in bed, tossing, turning maybe a little bit, but not really putting any gravity or weight throughout your spine and back. And then throughout the day it does get better. There's also a problem with what's called inflammatory arthropathies or inflammatory arthritis, rheumatoid or other types of not your typical wear and tear arthritis that is similar presentation. So it depends on how long the symptoms have been going on and how long they last. At the young age of 35, I wake up every day with back pain. So I understand until you get moving, it's common. But when you have a long commute or a driving, same thing. When you get out of the car, expect some stiffness. But if it's lingering for hours and hours, it's not normal. You should get checked out.